going to get started with our panel. So we first want to say thank you all for coming. Thank you to all for joining virtually as well. So this is our kickoff to Career Month. So it is our Careers and Conversations Healthcare panel. So we have a lot of exciting speakers today. So we're going to get started. So we have first Ms. Lanisha Neely, who is an outreach and recruitment specialist for the School of Health Professions at KU Medical, or UCHAM. We also have Ms. Carlina Klusmeyer, and she is a senior academic advisor for Central Methodist University School of Health and Sciences. We have Ms. Lindsay Coulter. She is a registered nurse as well as a JCCC nursing alumna, and she's currently a cardiac nurse at Advent Health Shawnee Mission. And then we also have Ms. Kelly Ostrich, who is the director of the JCCC Respiratory Care Therapy Department. We can give them a round of applause for joining us today. And thank you all for coming. So first, if you guys want to, do a little short intro about why you got into what you're into and, really kind of what drove you into the healthcare field.
Okay, so like she said, my name is Lanisha. I'm an outreach and recruitment specialist for the UCHAM program at the KU Medical Center. What drove me into the position that I'm doing now, as far as being a recruiter, is just my past experience. I also, as a student, I went to Longview Community College. I worked on campus, and that's what kind of sparked my interest in higher education. Being a student on campus and working and meeting other students, and also being a first generation college student, I came into contact with a lot of people in my family, and they're like, well, how do you get into school? And so just giving them advice on like things that I've been through and how to get themselves enrolled. Then I realized like, oh, you can actually work on a college campus and work with students, and kind of felt like what I was advising them on was something that people do as far as like academic advisors. So for the longest, I really wanted to be an academic advisor just because I felt the passion of giving back my experience to people that asked me, how did I get in college? But now I found myself as a recruiter, and I enjoy being able to travel, meet new students, and kind of just share the opportunities that we have at the KU Medical Center, the students that I come to contact with.
I am Kelly. I am a respiratory therapist, and I grew up here in Johnson County. I graduated from Blue Valley High School in the 1900s. And I always knew I wanted to go into healthcare. I really didn't know what I wanted to do in healthcare. I thought nursing at first, and then in school, an advisor told me about respiratory therapy when I was going to the University of Kansas. So I looked into that, and I absolutely love it. It's the best decision I ever made. So I worked at St. Luke's Hospital on the Plaza for 17 years in their med-surg trauma ICU. And then I started getting respiratory therapy students that would follow me in the clinic, and I really enjoyed educating them at the bedside. And a faculty position came open at the college 10 years ago, and people kept asking me to apply, and I did, and I love it. I love teaching students. I miss patients, but I love it when I'm working with a student and then they finally figure something out and I see that it clicks in them. And I'm so proud of my students. And I've seen my students take care of my family members, so it's very important. I take my job very important, and I want them to have good quality education, and I just love what I do.
Hello, my name is Carlina Klusmeyer, and I'm with Central Methodist University. And I kind of got started out just in healthcare advising at a technical school in Missouri. It was a small school in Boonville, which is right outside of Columbia. And I started out as a secretary and just kind of was working with practical nursing students, CNA students. We also had other programs there like EMT and CPR courses, but they also did welding and computer classes. And I just kind of really fell in love with helping students at all levels. So we had high school students that would come down to our school, but we also had adults that would come in as well. And they really just wanted to know, how can I achieve my goal? And that was my passion. How can I help you achieve your goal? So is your goal, to be a nurse, or is it to be an administrator? How can we get all of these things accomplished for you? And once I left the technical school there in Boonville, I went to work at Central Methodist University. And I started with the online program, which is where I still am. I'm the senior academic advisor there, and mainly in online programs with the RN to BSN, but we also have an online health science program, health administration, other programs available online for students. So I advise students all over the United States in order for them to complete their goal and receive their bachelor degree in an affordable and convenient pathway. So that's kind of my background. My daughter also is in healthcare. She does ultrasound. She's an ultrasound tech. She kind of hopped around from school to school, so I was able to get some experience with her, because she went to 5 schools. She finally completed, but she started out, in one school, didn't really care for it, moved somewhere else. And then eventually she graduated from the University of Missouri with a Bachelor's of Health Science and Radiography certification. Then she decided she wanted to do ultrasound and came up here to Kansas City and completed an ultrasound certification with St. Luke's. And now she does travel ultrasound, very similar to a travel nurse. So I use her experience a lot when I'm working with students, that even though you're not quite sure exactly where you want to start or where you want to, be when you first start out, the end goal eventually will come to you, and then it can be very rewarding.
My name is Lindsay Coulter. I was a previous graduate here of the nursing program back in 2023. I was able to achieve my BSN dual partnership with KU. So yes, an associate's and bachelor's at the same time. I am your classic trope of I always grew up knowing that I wanted to be a nurse. Started off with learning that Band-Aids make boo-boos better. When you're like this tall and you're being taught about first aid. And I decided, well, especially with my younger brother, who is a very, very accident prone. So if one Band-Aid makes boo-boos better on my little brother who screamed with me, how quickly would a box of Band-Aids make his boo-boo better? And from then on, my mom's like, yeah, she's gonna be a nurse. It eventually came. I worked as a CNA for about 8 years at Children's Mercy, and then I was able to complete through Johnson County and KU, and now I've been a nurse for 2 years on a cardiac care unit, and absolutely love it.
Wonderful, thank you all so much. So kind of diving into the education and training. So what education or training or soft skills helped you the most in your career? And for our admissions reps, what skills would you say students should focus on strengthening during their years prior to transferring?
I think that working as a CNA previously really helped, at least with kind of having a baseline knowledge of what all is expected of you in the hospital, vital signs, communication with patients and peers, learning to escalate anything that's of concern, any abnormal vital signs. It also kind of helped with time management, which is absolutely huge. Anatomy and physiology, those are a couple of the big classes that you're gonna need to take. Take those very seriously. It's not just, I just need to pass this class, I just need to get the same. This is what's gonna help me understand and connect the gaps between different disease processes. And that really, really helped to better my understanding clinically, like what all is going on. And it helped me out in school. A great thing.
I will agree with her. I think the science classes, you really need to focus on making sure that you do well in your science courses. Time management, she mentioned that as well. Be not only that, but problem solving skills. So when you are faced with a conflict, work on resolving the conflict in in a dignified manner so that it is not an issue in your career or in your schooling. I sat on some admissions boards a few years back, and I will talk a little bit more about the science classes. She mentioned anatomy, and I will also say microbiology, your chemistry courses. Take those all very seriously and keep those grades up. And if you be a self-advocate, so if you are struggling, go in and ask for help and take advantage of the resources that are available to you. Don't just sit back and say, oh, I can't get this, I don't understand this. Reach out, and someone in the whatever school you are going to will be able to assist you and provide additional guidance so you can be successful in these courses, which are extremely vital for all of the healthcare nursing type programs that you're pursuing.
I would have to agree with a lot of what these two ladies have said. So take anatomy and physiology, microbiology, chemistry. The biggest indicator of how well a student is going to do in a healthcare program are their grades and their science courses. Now, that being said, science, I think there's a big misconception that science and math have to come easy to you to do well in healthcare. And that is not the case. I struggled in science class, and I had to have extra help from my teachers. And just know that your teachers are there, and they want to see you succeed. The smartest students I have are actually the ones who come to my office hours and make appointments and sit with me and ask the most questions in class. And unfortunately, the students that I need to come, I want them to come see me, don't, and they end up being the ones who really struggle. So don't be afraid to ask questions. And communication is another big skill that you'll have to have if you go into healthcare. You're going to have to be a patient advocate, and you're going to have to call physicians. If you work night shift, which a lot of people will do when they first start out, you're going to have to call a physician at 2 a.m. and wake them up. So you want to make sure you have good communication skills and can advocate for what you need for your patients.
Felt like they took all my English. But I agree with everything that they said. The only thing I would probably add is like, when she talked about communication, but also empathy, being able to like place yourself in that person's shoes. And maybe it may not have been a situation you've ever experienced, but knowing how to communicate with the patient, or even if you're working with a kid and you're communicating with their parent, just having empathy and understanding that this may be someone's worst day. This may be a time in their life where they've never experienced this before. And because working in healthcare, you all are going to see things that most people don't see on a regular basis. So just understanding that because it's maybe normal to you, it may not be something normal that the average person has experienced before.
Thank you, that's a great answer. So with that, what makes you all's companies or schools, environment and programs stand out from any other program?
I would say with KU, one of the things like the class faculty to student ratio is pretty low. And then also, what's the other thing I would say? Also, the faculty teaches in a way like they look at their they look at their students as in their colleagues, because they understand in the future, like I think somebody just mentioned about working with I don't know, somebody mentioned something very similar to what I'm trying to say, but a lot of the faculty members they don't see them as just as students. They see these are people that I'm going to be working with eventually in the field. So a lot of for instance, one of the programs that we work with is we have a respiratory care program, and he talks about all the time how a lot of the students end up becoming people that they work with. So I would think that's something that kind of helps us stand out, is that you're not going to just be talked to as if you're a student. They want you to learn. I think it was, somebody said they're paired. Okay, that's what I was trying to say. You said your mom or someone has come into contact with students that you have taught. So that type of mindset is that we understand, because a lot of the students practice in the communities they come from, that there is a likelihood that I may run into contact with a student that I have trained. So I want to make sure that they are very knowledgeable because I won't be surprised if one day I walk into a hospital and they're the ones that's treating me. So. Small world,
Well, our program is at Johnson County Community College, which is an amazing place to go to school. And we are located at the Olathe Health Education Center, which is next to Olathe Medical Center. We have an amazing simulation center just for our respiratory therapy program. We get to know all of our students on a personal level. We spend hours and hours with them, and we have small class sizes. We only accept 18 to 20 students right now just because of space. Our outcomes are amazing. For the past 4 years, we've had 100% pass rate on the board exam. So our students graduate and they are successful. I would encourage you, no matter what healthcare program you're curious about, to look at their outcomes. That should be readily available to everybody who's interested. All programs have to be accredited, and their accreditors require that they post outcomes on their websites. So look into that because not all healthcare programs are created equally, and you want to make sure that you're getting your money's worth. We also have 14 clinical affiliates in Kansas City. Many of them provide internships for our students, will pay for their education. There's also the Kansas Promise Scholarship right now if you live in Kansas. I'd encourage you to talk to counseling or financial aid about that. It'll pay for a lot of the healthcare programs here at JCCC.
So Central Methodist University, we are located in Missouri, and we are a small liberal arts university. We have a almost brand new building of health science, the Throckmorton building, which has state-of-the-art equipment and simulation room. Our students, I think one of the things that set our students apart when they go to our campus is that we are Apple distinguished. So all of our students will receive an iPad when they go to campus. All of our classrooms are connected through the Apple system. And if I can just read this real quick, this is from our president. We are proud to say that Central Methodist University is a leader in bridging the digital divide, ensuring that every student, every day, regardless of financial background, has equal access to cutting-edge technology. And that is what the Apple Distinguished School allows our campus students to do. In addition, we have a massive online program. This allows students to, we are partners with Johnson County Community College, and we are also partners with every community college in the state of Missouri. Our partnership also includes schools and churches and hospitals, allowing students to transfer credit hours in, get their clinical experience where they choose to get their clinical experiences at, and build their rapport with wherever they are working and complete their degrees in that fashion at an affordable and a flexible, convenient kind of route, because not everybody has the same pathway. So we kind of try to provide different pathways for students. We also have an accelerated program in Columbia, Missouri for students that really want to get done quickly. So as long as they have all of their gen eds and their science, they can go to our suite, that we have a little suite there in Columbia where students can complete there. So there's a lot of options. I'm not trying to pull you away from Kansas by no means, but we're just a few miles away. So there are some options out there for you if you're looking to expand and go elsewhere as well.
With Johnson County, they have such a high demand for quality. I put my words. They have such a high dedication for high quality education at a very, very affordable cost. Johnson County is one of the most affordable nursing programs that's around this area. Some of the things that helps tremendously, especially if you did struggle or do struggle financially, is that they do have the Kansas Promise Scholarship, which I actually did use, and it really, really helped. They also have the Zamorowski Simulation Center, which after having gone through the simulations and been now practicing for 2 years, I can say that they are very, very realistic in what they do. It's I absolutely loved the Johnson County program. It was absolutely grueling. However, it's definitely set me up for success and made my transition into the real world a whole lot better than I would have possibly thought. There's a lot that you see out there on social media of like, it's nothing like you ever would have thought. To an extent, yes, because Johnson County and most other nursing programs, they set you up to prepare you for the biggest licensure exam that you can take, which is the NCLEX. And that is what they try to focus on and what they want you to do well. Because yes, the pass rates are absolutely important. Definitely check those out. I know for my class, I want to brag a little bit. We had a 100% NCLEX pass rates. And Johnson County continues to have very high pass rates along with KU. KU, with what they did, because I did do the dual partnership, they provided the academic depth into the more nursing leadership and evidence-based practice side, which is something that you absolutely should take into consideration too. It's like, do we want to do a 2-year degree and get your RN, and then once you're in the field, get your bachelor's, because most hospitals are going to want you to have that 4-year degree. So I think considering where you're at financially, where you want to go, what you can afford to do. Can I afford to do a 4-year program? Can I afford to do my 2-year and then later on do my bachelor's? Is something that to consider, but I would highly recommend the JUCO program.
Thank you. So really to build off of that, so for people who are in admissions, how does your school help transfer students adjust academically and socially? And then for anybody working in the field, what would you say a transfer student should do day one at a new institution or a new job?
I'd say talk to as many people as possible. You never know what kind of doors that's gonna open. Come back to me.
Okay, so day one, and I'm going to talk a little bit about both our campus and our online program. So if you're on campus, day one, take a tour. If you have not already, make sure you know where your resources are, that you have your Wi-Fi set up, just things that you may not think about until you're in class and you're like, oh no, I don't have my password, those types of things. Be prepared. Set your schedule so it's manageable for you. Don't try to overwhelm yourself doing everything that first week because it's going to be an adjustment. For our online students, you have a little bit more flexibility and convenience. We do offer an orientation class so that students can utilize the website, because even a website can be kind of difficult to maneuver and like, where do I go and find my library resources? And I need to do this paper and I have to log in and it's asking me for all of these additional things. So, the orientation class that we offer allows you to go through those resources so you know where to click and find these things. And it's typically just something that simple. And then as an academic advisor, I will have to say, just reach out to your advisor. If you ever have questions on how to find something, I have like a little cheat sheet that I just keep saved on my computer. And when a student says, I can't find where to find my books or something like that, just cut and paste and send it. And 2 seconds later, they have it. So those are the types of things that day one, those are the things that, will help you be successful in the class. Your instructor is going to be there, of course, for you. So make sure, don't feel, embarrassed or shy. Make sure to advocate for yourself if you do have questions.
Well, day one as a student, I would say it's important to make connections, get to know people in your classes, get each other's phone numbers. do study groups together, and also time management is gonna be really important. Don't underestimate the amount of time it's gonna take to study. And then what I think we do a good job transitioning you into the workforce with all of the clinicals. And I would just encourage you to always be professional, show up on time, ready to go to work. Be careful for what you say because you can't put it back in your mouth. And all of our students, I always tell them, even though you're there as a student and you're there to learn, they're interviewing you and they're watching everything that you do. And they're gonna wanna know, they're gonna ask your preceptors, that's somebody that we should hire. So just know that you're always on a job interview when you're doing your clinicals.
Yeah, I would also say the resources on campus, figuring out what do they offer on campus. I know like by the time I completed my undergrad degree, and then I went back looking at like everything that I had paid for within my tuition, and I'm like, I didn't even know I can go to the gym for free, or I didn't even know, like that there were certain student discounts that was available just because I was a student. So I would definitely say, use your resources, use the fact that you are a student. I had a really good friend of mine, she would always tell me, everybody loves a college student. So get it out there and trying to connect with internships and things that can actually give you some hands-on experience. But that goes back to like networking, making sure that you're just connecting with the people around you. Because as someone else just said, you never know who that next person that's sitting next to you, what they're gonna be doing in the next 4 or 5 years after you guys leave school. But if you're able to leave a good impression and networking with people, you may find yourself with a great opportunity just because someone likes you. So a lot of the times sometimes it's not even about how talented you are. Because I always tell people we can learn the job. Like for the most part, we're smart enough to learn what we're supposed to do. Some of the most challenging part is just getting along with people and things like that. But if you are able to make a great impression on someone and then they see you years later, because of that impression that you made, you may find yourself in a really great position just off of your personality.
There you go. Okay, so kind of coming back, they all mentioned really, really good things, getting to know who, exchanging phone numbers, because you guys need to set up study sessions like as soon as possible. You'll absolutely hit the ground running. With the Johnson County program, they set you up with a nurse success advisor, and knowing who that is, and it's usually one of your professors, because there's a lot, they can take up to 60 in the nursing program. And dividing that in between the different instructors makes it a little bit easier and a bit more manageable. And it gives you more one-on-one time with a instructor who is gonna want you to succeed. They're gonna wanna give you, whether it's additional resources or a different way of trying to think about a problem or a clinical diagnosis. That really, really does help. Getting to know your peers, because from day one until the end, you guys are all working towards one common goal, which is to become a registered nurse. And one day you may work alongside these same people. So not only are you trying to grow yourself, but you're also trying to study with other people who are going to be taking care of your loved ones and out in this field. And then also to mention too, the clinical side, every time that you're at clinicals, those are your absolutely some of the best opportunities to get a head start on job hunting. If you're not already in the field, if they say, oh, well, I can't remember if it's, if the nursing program requires that you have CNA or some sort of healthcare experience. They waived that temporarily. I was a COVID student. So it was temporarily waived because those trying to get their CNA were in the middle of clinicals, which what could you do when there was no clinicals to go to? So they temporarily waived that. But if you don't have clinical experience, or if you don't have CNA experience or CMA experience, that's okay. This is the opportunity to kind of look around and see what jobs are out there. And you're going to be exposed to so many different places too. We go to St. Luke's and Shawnee Mission on some of their different floors. We go to Overland Park Regional, Mid-America Rehab. So many different opportunities to grow your skills.
Yes, thank you. So with, I'm glad you brought up job hunting and kind of starting day one. So what career development or job placement resources does your organization or school provide or did you use when you were going through the program to help students succeed after graduation?
Clinicals definitely helped. I previously was at Children's Mercy, so that already I had a foot in the door in terms of pediatrics. But also, if you're curious about a different facility or a different hospital, you can always reach out and ask for shadowing opportunities, and that can provide some great insight into what a day in the life of a nurse or respiratory therapist or different healthcare profession is. And I would recommend just continuing to reach out and build connections.
So with our, very similar to our main campus program, we have the same type of ability for students to do their clinical. It's not going to be here in Kansas, of course. Our clinical is done in the Columbia, Missouri area, so University of Missouri, and Boone Hospital, all of those in that kind of 45-minute range area. That's for nursing. We also have an athletic training program. That's a graduate degree. So you go in as exercise science and then you get your athletic training. They will do their, what was the question? No, you're fine.
What career development or job
Okay.
placement resources?
Okay, so their internship and their job shadowing for the athletic training varies. For athletic training, they have some specialty areas such as the minor league baseball, some of the minor league baseball teams, they have connection there. They will allow you to do your clinical at some of the high schools, at different colleges, depending on where we can get you placed. For the online students, by the time you come to us, you will already have your nursing license. You will already have set for board. So you're working on your BSN. We do have clinical components built into the program, but we use an online simulator. And we also allow you to do your clinical portion where you're working. So we don't require you to go to a specific area if you're in the RN to BSN program. And then some of the other types of, like if you're doing the health science online, say you're doing respiratory therapy or radiography and you are wanting to get your bachelor's degree, you will do your clinical components where you're working. So for the online part, you're already registered, you're already licensed. We're just going to work on getting your bachelor's degree with that part of it. Hope that makes sense.
Well, there's lots of jobs out there, I don't know if you've heard, in healthcare, and really people are kind of beating down the director's door to get in front of students. I have so many requests to meet with students that I don't let them have class time anymore, but I always pass that along to students. But I would just encourage you when you're at clinicals to pay attention to the culture of the facility and see how well members of the healthcare team work together. Does the place have the latest and greatest technology? And then if you're interested in getting your bachelor's degree or master's degree, I always encourage people to further their education. And I think probably all of the hospitals right now have tuition reimbursement. So you can graduate with an associate's, get a job in the hospital, and then they will pay you to get your bachelor's degree or master's degree.
Yeah, so for School of Health Professions, I work for a program called UChamp, and UChamp is a program that we work very closely with not only students within the School of Health Professions, but we also work with students that are as young as 11th grade in high school. And we work with students that may be at a community college level that may say, I want to go into healthcare and I'm just looking for an opportunity right now because I'm interested in maybe going into physical therapy. So then we put different programming and activities on to help these students gain experience to help build their resume. Because a lot of the programs that we offer at the School of Health Professions, you can't just apply and get admitted directly into these programs. You have to go through an interview process. And they look at maybe like you have to have a resume, so with UChamp, it's like, what can we do right now where you're at your educational level to help you build that resume? So that when you do get to the point of applying, we help you get your resume to stand out. So that's one of the things that we're doing at the School of Health Professions at KU to help get students some experience so that, like I was saying, when they get to the point of applying to these programs, they have a really good chance. Or even we may even work with a student that says, I have no idea what I want to do. I'm just looking for an opportunity to gain some experience. Then those students will also join UChamp. Or we may work with a student who says, I know I want to go into healthcare, but I'm not 100% sure what type of healthcare. So I don't know if you are familiar with the School of Health Professions, but we have over 30 different degrees and certificates that do not require students to go to nursing or medical school. Because most times when people think of going into healthcare, they think nursing and med school are the only two routes they can go, and they often forget about all the other parts of healthcare, and that's kind of what we offer, all those other things in healthcare.
So with, healthcare and the industry and just programs in general, where do you see your industry or academic program heading in the next 5 to 10 years? And what do you think that students should start focusing on now to prepare?
And we see like a growth in just needing more healthcare professionals because people are living longer. So that's one of the things that we are like, even with like clinical laboratory science. I don't know if you're all familiar with that degree and what they do, but that's one of the fields that they anticipate is going to need a lot more people in those areas. And what was the second part of the question?
And what should they start focusing on now?
Just focus on getting the experience. So joining a program like UChamp that's going to be able to solely help you gain some experience, help you build your resume, and also help you feel like you're not doing it all on your own. You have someone there that can actually help you.
Well, so the next 5 to 10 years, our program, we're looking to expand the program. The college is working on their next master plan, and part of that master plan is to build a new healthcare science building. So we will be relocating back to the main campus, and we hope to grow our cohort size so we can take 25 students. I know that doesn't sound like a lot, but that is a lot. Respiratory therapy is projected to grow 12% in the next 5 years. And everybody knows there's a dire need for nursing, but nursing is expected to grow at 6%. So respiratory therapy is expected to grow at a much faster rate. There's a lot of people retiring right now. And I would just say all of these programs, they're all selective admission. So practice your interview skills. The college has lots of resources here that will help you prepare for your selective admission interviews into any healthcare program that you're considering.
So on a broader scale of things, I would recommend that you prepare more for AI and become more adaptable, because AI is going to be in pretty much everywhere that we go in the future. They already have at some of the hospitals cobots, and these are just robots that go in and they may do some cleaning or they may deliver supplies, but that is going to continue to grow. So focus a lot on your skills for patient care, but also be adaptable so that you can work with the technology that is going to be our future. And I will reiterate on her, the improving your critical thinking, and I had a note in here also, your communication skills, which I obviously need to work on those.
Me, I had a fumble over my times. You all mentioned really good things, building your resume, networking. Yes, and I will say I absolutely love respiratory therapy. I work alongside many of them, and there are some aspects of nursing that I would say that I have a strong suit for, and respiratory is not one of them. So for one, I want you also to appreciate the other departments that you're working with. It's not higher or lower. You guys are working alongside each other to take care these people, regardless of your field, whether it's pharmacy, respiratory therapy, occupational therapy, physical therapy, nursing. We're all working together with the common goal of taking care of these patients. I would recommend also becoming more data literate and technologically literate. Trying to keep up with it can be grueling, but there are classes out there available for, even if it's like I need to work upon Microsoft Word or trying to understand computer skills a little bit better. There's classes out there, but AI is absolutely going to play a part in the future. I would also recommend that yes, you absolutely build on your clinical judgment and continue to want to learn. Education and certifications, hospitals are gonna push for that. One, it's good for yourself. The more knowledge that you're able to acquire and the certifications, one, that get that pay. It will absolutely help with the pay bump. And it just shows that higher education correlates with better patient care and safer patient care, and that is all through evidence-based. And in terms of nursing, yes, we always need nurses, and it's such a versatile field. The bedside is not the only place you have to start at.
And for our last question, if there was one thing that you would want students to take away from the panel when looking at transferring or entering the workforce, what would that one thing be?
I have a few things. You're never too old to start. I had a lady in my cohort when I was in nursing school that she was in her 50s. She's like, I'm a grandma. I'm like, I don't care. You're here. That's awesome. You're never too old to start. Be proactive and think big picture. Where do you want to go? And if you don't know, that's okay. Make a list and then kind of explore those different options. Shadow, get information, ask questions. Be willing to grow and be willing to step outside your comfort zone because you won't grow if you're comfortable.
I would agree with that. I also would like to mention that your first job will probably not be your forever job. So build upon what you are learning, take all of that knowledge so that you can grow in your career. It's a big world out there. There's a lot of opportunities, and just explore everything available to you. Don't feel pressured, but also don't keep yourself in a box so that you can look outside that box for other opportunities. And that will help you not only find advancement in your career, but also in your paycheck or yourself being able to be self-satisfied with what your choices are, and know that there's people out there to help you as well. So even after you graduate and you move on, don't let your connections with where you came from end. Keep involved with those individuals because they may end up helping you for reference letters or ideas that you may want to do later on in your career.
I would just encourage you to look at all the different career pathways that these different healthcare fields can take you. Some of the best physicians I've ever worked with were respiratory therapists. You can get a registered nursing degree or a respiratory therapy degree and then apply to physician's assistant school or medical school. You don't have to take a traditional pathway to get where you want to go.
I would say, understanding that you don't have to figure it all out on your own. You have people and resources here that will help you. Just like I was saying, like the UChamp program, that's our job. Like that's my job, is to work with students, is to answer questions, is to point them in the right direction. So don't ever feel like I have to figure this all out by myself, or and that's why it goes back to understanding what resources are around you, so that when you do come up to a stumbling block, you know the right people to connect with that can help you.
Thank you all so much.